استدراكا للكلام اللي أنا كلمت بخصوص regarding the pathobiologic mechanisms of disease والbiological basis of disease in order to further clarify the issue for clinicians واستكمالا to my previous presentation about the biological basis of disease and the pathophysiologic mechanisms or pathobiologic mechanisms of disease. I have mentioned before that the biological basis of disease is what happens at the molecular and cellular level predisposing to the occurrence of some pathology and causing a clinical disease, which presents as clinical manifestations, symptoms, and signs. And this includes disruptions in the organisms, that is the individual, that is the human organ or system structure and function at the molecular, cellular, and genetic levels, which might be triggered by genetic mutations, oxidative stress, abnormalities in signaling pathways affecting the biochemical and metabolic signals or pathways, and or inflammation or some other foreign agents like infective agents. These genetic mutations, signaling pathways, abnormalities or disorders, oxidative stress or inflammation or infections, they trigger this disruption at the level of the molecules, which play a role in the cell-to-cell interaction, like the cytokines and chemokines, or at the level of the cells, at the level of the receptors or post-receptors in the cytoplasm or in the nucleus. That is, to be more precise, in the nucleus will be genetic. But sometimes, in order to be more clear, we separate genetic from cellular, but we can consider it as part of the disruption at the cellular level, because at the cellular level, this will include the cell wall, the cytoplasmic membrane, the cytosol or the cytoplasm, which includes the cytosol and the organelles swimming in the cytosol, like the endoplasmic reticulum, like the mitochondria, like the Golgi apparatus, like the vacuoles, like organelles, and others. And then the nucleus inside the cytoplasm. And the nucleus contains, of course, the basic structural units which control the proteins and which give signals for or instructions for formation of proteins or functional RNA molecules, which will cause the problems or disruption in the cell and then the cell-to-cell interaction. And this is the genes, which are, as we all know, the gene is the structural and the functional unit, which gives instruction to sensitize certain molecule which control some hereditary character or characteristic of the individual. And this is the structural and functional unit of heredity, the gene. And the gene, as we all know, lies on the chromosomes, because the chromosome is the large coiled structure formed of DNA, which can be seen under the electronic microscope or electron microscope. And the genes are smaller structures on the chromosomes. That is, the chromosome is like a book and the gene is like a sentence or paragraph in the book, which gives instruction for synthesis of different proteins which guide the characteristics of the individual or of the organism. So the abnormalities or disruptions which happen at the molecular and cellular and chromosomal or genetic level is forming the biologic basis of disease. In other words, it is what we call the molecular pathogenesis of the disease. Which is important to understand the molecular pathology, the therapeutic targets which are targeted by the therapeutic agents, especially what we call the biologics. Because the biologic therapy or the biologic medications, they act at the molecular biological units, that is the molecules and the cell receptors and the or post receptor. So these therapeutic targets we have to understand as a part of understanding the role of molecular pathogenesis. What are the therapeutic targets which are targeted by drugs, which we call it the biologic medications or the biologics, which is a breakthrough in pharmacology or in clinical pharmacology in the current era, especially the last 10 to 15 years, as we all know. The biologics which used in many medical diseases, chronic diseases like in diabetes, like in asthma, like in migraine, like in cancer, like in many medical problems or diseases. So this is the importance of understanding the role of molecular pathogenesis. The pathology, the molecular pathology of the disease, the therapeutic targets, and which are targeted by the therapeutic agents, the biologics, and also to understand the concept of what we call precision medicine. Because precision medicine depends on understanding the underlying genetics and the underlying molecular pathogenesis of the disease. You have to understand the underlying molecular and cellular and genetic changes in order to choose and tailor the best treatment according to this characteristic of every individual patient, his molecular and genetic and cellular characteristic of the individual, which are believed to play a role in the pathogenesis of the disease or the molecular pathogenesis. So molecular pathogenesis is essential to understand the precision and to apply the concept of precision medicine for every individual case or individual patient. This is what we call the molecular pathogenesis. So this is the one element or one form of pathobiologic mechanism, the molecular pathobiologic mechanism. We have another pathobiologic mechanism at a gross level in the tissue, not at the level of the cell and the molecules and the receptors and the genes, but at a gross level in the tissue, at more macroscopic level. We can say macroscopic, because the pathobiologic or the pathophysiologic mechanisms of disease are one of two things. They are to be more precise so that the clinicians will understand and to the issue is clear in the mind. Because this is very important, as I mentioned, in order to be a good clinician, to understand the pathobiology of disease, which is the core of the disease and the core of pathology which causes the clinical disease. In the form which appears in the form of clinical symptoms and signs. As I mentioned before, clinical symptoms and signs, they are just the external appearance of the clinical disease, but the clinician should understand the core of the clinical disease, which is the pathobiology or the pathophysiology of the disease at the molecular level and at or microscopic level and at the macroscopic level. So there is microscopic pathobiologic or pathophysiologic mechanisms, which I just mentioned and I explained in short, and we have the macroscopic or gross pathobiologic mechanism in the tissue or in the organ. For example, I will give an example. In diabetes, for example, in the diabetic syndrome, we all know that diabetes is a syndrome. Now, we consider it as a syndrome rather than just a disease because it contains many types including the type 2 diabetes, type 1 diabetes, gestational diabetes, type 1, type 3, type 3A, type 5 now, and the other forms of secondary diabetes, and the monogenic diabetes, that is the Modi syndrome, the maturity onset diabetes of youth, etc. So it's a syndrome with different types, different classification, variable classification, variable presentations clinically, and variable clinical course, and variable natural history of disease in each type of diabetes. So although the denominator or the marker in all patients is hyperglycemia, but diabetes is not just hyperglycemia. And hyperglycemia is not only caused by diabetes. We have what we call non-diabetic hyperglycemia, for example. So diabetes is not just hyperglycemia, and hyperglycemia is not just diabetes. That's the other way around. This is a very important fact. In diabetic syndrome, the pathobiology or the pathophysiology is variable. And I have mentioned this before in my diabetes lectures over the past few years, in the, when I was in the United Arab Emirates, and in many TV episodes in which I presented, and in many lectures I have shown up for in Abu Dhabi and in Dubai. I have already talking about such issues, and the one of the most important is the diabetic octet. That's the 8 mechanisms which underlie the pathogenesis and the pathophysiology of type 2 diabetes, which is a very common, or the most common type of diabetes in adults. Versus the type 1 diabetes, which is more common in the children, as we all know, which previously called the juvenile diabetes, but no more called the juvenile. It's just type 1. Anyway, we have, for example, at the gross level, there is incretin abnormality, or the incretin theory in the one of the 8 mechanisms. Of course, the basic mechanisms is insulin deficient, insulin resistance. This is versus insulin deficiency in type 1. Here, insulin resistance play a role. Increased and insulin resistance at the level of the adipose tissue, at the skeletal muscles, the peripheral insulin resistance, and central insulin resistance at the level of the liver, and or increased hepatic nocturnal glucose output, and another mechanism. Also disordered glucose transport at the level of the kidney, at the level of the renal tubules, and this is the kidney role in glucose homeostasis and in carbohydrate metabolism, and this is the basis of the use of the STLG2 receptor antagonists now, or inhibitors, in treatment of diabetes, acting on the kidney to decrease the tubular reabsorption of glucose, and so it decreases hyperglycemia and increases the urinary glucose output. And the insulin resistance at the level of the brain, and the incretin theory, that is, there is disorders in incretins. That's why we use the incretin-based therapy, in order to use drugs which mimic the effects of incretins to increase the insulin release, whether the GLP-1 receptor agonists or the DPP-4 inhibitors. The GLP-1 receptor agonists, they promote the effects of glucagon-like peptide 1 and mimic its effects in increasing the insulin release, and so decreasing the hyperglycemia, or antagonizing the hyperglycemia, or exert its anti-hyperglycemic effects. And or the, of course, also the other incretin is the glucose-dependent insulinotropic factor, or the GIP, the glucose-dependent insulinotropic peptide. So the GIP and GLP-1 are the main incretins on which the GLP-1 receptor agonists work, or by inhibiting the DPP-4, which is dipeptidyl peptidase enzyme, which causes breakdown or destruction or catabolism of the incretin. So by using the DPP-4, these are the two main groups of incretin-based therapy, the GLP-1 receptor agonists, which increases insulin release and slows gastric emptying and help to decrease the body weight. And the DPP-4 inhibitors, which inhibit the destruction of the incretin, so they promote elevation of the incretin levels, GLP-1 and GIP, and cause insulin or promote insulin release. This is the incretin. This is the abnormal incretins in the pathogenesis of type 2 diabetes, and that's why this is the basis, one of the important tools to treat hyperglycemia. And an application of what I mentioned, the pathobiology-oriented therapeutic treatment. So the pathobiology-oriented, part of the, as an example of the pathobiology-oriented therapeutic approach is the use of incretin-based therapy in diabetes, because incretin abnormality or defective cretins or disordered cretins, which are secreted by the gut, the GLP-1 and GIP is one of the gross pathogenetic or pathophysiologic disturbances or mechanisms in type 2 diabetes mellitus. So the incretin abnormality is macroscopic in the tissue here. And of course, behind the incretin abnormality or the disordered incretin control, which play a role in the physiology of glucose metabolism or glucose homeostasis, in addition to the role of the liver, the role of insulin by the pancreas. So it is an interplay of many organs which causes disordered carbohydrate metabolism and the hyperglycemia at the end as a denominator. The defective pancreas, problems in the liver causing increased hepatic glucose output, problem in the gut at the level of the incretins, problem in the kidney, problems in the brain, problems in the insulin antagonists in cases of secondary diabetes, with elevation of growth hormone or thyroxine or corticosteroids, which are all insulin antagonists, and they play a role in the pathogenesis of secondary endocrine diabetes, or pancreatic diabetes in cases of diseases causing destruction of the pancreas. These are the two main forms of secondary diabetes, pancreatic and endocrine. Anyway, this is this is to exemplify the gross or tissue pathogenesis or pathophysiologic disturbances at the level of the tissue. But behind them is the molecular pathogenetic mechanisms due to disturbances at the level of the molecules or cells or genes. And this explains the role of genetics in some cases of the diabetic syndrome, like the role of genetics in the MODY syndrome, the maturity onset is a monogenetic forms of diabetes, the MODY or the maturity onset diabetes of youth. Here, the cause of the hyperglycemia is at the molecular level. That's why at affecting single gene. That's why we call them monogenic. Or sometimes also in the pathogenesis of type 2 diabetes, genes may play a role as molecular pathogenetic mechanisms or pathogenetic or pathobiologic mechanisms in type 2 diabetes. So اللي ورا الجروس pathobiology أو pathogenic أو pathobiologic أو pathophysiologic mechanisms اللي هي الانكريتين disturbance أو الانسولين ريزيستنس أو على مستوى الاديبوز تيشو او السكيليتال ماسل او البريفرال انسولين ريزيستنس يعني او السنترال على مستوى الليفر او الانكريزد هيباتيك جلوكوز اوتبوت او الميكانيزمز اوف hyperglycemia due to problem at the level of the kidney او التايب 2 التايب 5 diabetes او البنكرياتيك diabetes اللي هو 3A type of diabetes دي هنا في genetic factors playing a role. يبقى اذا في عندنا نوعين من we have two major types of pathophysiologic mechanisms at the gross level in the tissue, and behind them خلفهم at the level of the cells and the molecules and the genes. That in short isn't here. That's why here we as clinicians we have to understand when we tailor treatment and to understand why we pharmacologically approaching such disease, for example, like diabetes, and the same can be applied to other chronic disease, like in epilepsy, like in epileptic syndrome, like in bronchial asthma, like in migraine now, like in many other medical diseases. In the ITP, in cancer, we treat by biologics. In multiple sclerosis, we treat by biologics. In many chronic diseases, we have to understand the basic, the molecular pathogenesis, that is the microscopic pathogenesis in the cells at the level of the cells, and how we target them by specific biologic agents, and to understand the pathobiologic mechanisms at a more macroscopic level in the tissues and in the organs, as exemplified, for example, by incretins in the GIT or insulin resistance, or this is another level of pathophysiologic mechanism. And here we have targets at the gross level in the tissue. We have some therapeutic targets, and these targets are targeted by definite specific drugs. And we have another therapeutic targets targeting the molecular pathogenesis of disease, which is the deepest اللي هو الجزء العميق من الباثوبيولوجي of the disease. So don't forget these two, the microscopic and the macroscopic, or the molecular and the tissue level pathogenesis or pathobiological mechanism of disease. لأن هم دول, these two are the targets of the drugs, which are going to be used in the chronic disease, whatever the type of disease. And I have just given diabetes as an example. And we have to understand it in every individual case, because it is different from patient to patient and from case to case having the same disease. And this is the philosophy of what we call precision medicine, or personalized treatment, or individualism. That is, we can't use one drug to treat all patients. For every patient, there is a specific drug which can fit and match with the pathobiology of the disease in this particular case, or this in every individual case, in every individual patient. And we have to understand again, the pathobiology of, for example, diabetes, of hypertension, of epilepsy, of asthma, in order to know how to select the proper anti-diabetic or the proper anti-hypertensive or the proper bronchial asthma medication or the proper anti-epileptic drug, or and so on, so on. So this is very important. This just to highlight and to clarify to clinicians what's meant by the pathobiologic basis of disease and the biological basis of disease and pathophysiologic mechanisms of disease, because it is basic to understand the pathophysiologic oriented or pathophysiology oriented therapeutic approach when we start to give or to select the medications and give it to every individual case. Thank you so much, Professor Dr. Tarek Ali.